to a new mom trying to figure out the best way to position your baby's arms while breastfeeding. In this video, I'm going to share with you some tips and tricks for positioning your baby's arms so that both of you can be comfortable during feedings. 1. What is the best way to position my baby's arms while breastfeeding? The best way to position your baby's arms when breastfeeding is with one arm tucked under your breast and the other hand lightly grasping around your breast. This allows for a more secure, comfortable hold on the breast and helps ensure that the baby is able to latch on properly and stay latched on. It also keeps the baby from pushing away from the breast during feedings. If you are concerned about hurting your nipples, you can use a soft cloth or blanket to provide extra padding between your skin and your baby's fingers. 2. What are the benefits of positioning my baby's arms correctly? Positioning your baby's arms correctly during breastfeeding has several benefits. It helps the baby latch on more easily and ensures that they can maintain their position without too much effort or discomfort. Additionally, positioning your baby's arms correctly can help reduce fatigue while feeding and make breastfeeding a more pleasurable experience for both you and the baby. Finally, correct positioning of your baby's arms aids in ensuring a proper milk transfer from the mother to the infant, as well as preventing any accidental spills from occurring. All these factors combine to create an optimal environment for successful breastfeeding sessions. 3. How do I ensure that both my baby and I are comfortable while breastfeeding? When positioning your baby and yourself for breastfeeding, it's important to ensure that both of you are comfortable. You may need to adjust the position several times until it feels right. Here are a few tips on how to get comfortable. Adjust the nursing pillow or cushions around you and your baby as needed. Make sure your back is supported in order to ease any strain. Wrap your arm or use pillows or blankets around your baby's body so that she is secure and does not roll away from you. Sit up straight but relaxed, with good posture, keeping in mind that a slight slump can help keep pressure off your shoulders if they're starting to ache. Support your baby's neck and shoulders with your arm while you get comfortable. Make sure your baby is close enough to you so that her chin is touching the breast. Experiment with different positions until you and your baby find one that works best for both of you. You can try lying down or sitting up in a chair, rocking, or nursing in an upright position. If you're nursing more than one baby, make sure each baby has equal access to the breast and adjust the pillows around them as needed. Be aware of any pain or discomfort during breastfeeding and take frequent breaks if necessary. 4. Are there any tips and tricks to help me position my baby's arms correctly? Yes, there are some tips and tricks you can use to help position your baby's arms correctly. Use a soft pillow or rolled up receiving blanket to support your baby's arms in the proper position. This can be especially helpful if your little one has weak neck muscles or is a bit wiggly during feeding. If your baby has difficulty latching on to two-arm positioning, try placing their hands near their mouth rather than behind their head. This may help them latch on easier and stay latched for longer periods of time. Try using breast gels between feedings to keep your baby's arms from slipping out of place while they are eating. Breast gels act as a barrier between the areola and your baby's hand, helping to keep their arms in the correct position. Be sure to provide plenty of skin-to-skin contact before and after feedings. This helps your little one feel secure and comfortable while they eat, which can help them stay positioned better during a feeding session. Give yourself some extra time between feedings if you need it. Making sure both you and your baby are relaxed is key to the successful positioning of their arms. With practice and patience, you will become an expert at positioning your baby's arms for breastfeeding in no time. 5. What are some common mistakes to avoid when positioning my baby's arms during breastfeeding? Common mistakes to avoid when positioning your baby's arms during breastfeeding include gripping the breast too tightly, pulling back on the breast too aggressively, and putting too much pressure on your nipples. It is important to be gentle with your baby's hands and make sure that their grip is loose enough that it does not become uncomfortable. Additionally, make sure you don't pull or push your baby's arms in an awkward direction while they are nursing, as this can cause discomfort. Lastly, it is best to support both of your baby's arms throughout the duration of a feeding session so that they do not get tired and lose grip easily. 6. Is there any particular position that is more comfortable than others? Yes, many moms find that the cross-cradle position is more comfortable than other positions. This involves holding the baby's arms across their chest and cradling their head in the crook of your arm. This can help to reduce strain on your back and neck, while also making it easier for your baby to latch on correctly. For babies who have difficulty latching, you may want to try a football hold or side-lying position instead. Whatever position you choose, make sure that it is comfortable for both you and your baby so that breastfeeding will be enjoyable for both of you. 7. How can I make sure my baby's arms don't get in the way when breastfeeding? The key is to make sure that the baby's arms are positioned in such a way that they don't interfere with the latch. If the baby's arms are too close to their body, they may unintentionally block the nipple or push it away from their mouth. You can try these techniques. Place your hands on either side of your baby's chest and secure them with your fingertips to keep them close to their body while you feed. If your baby is older, you can try pulling one arm at a time toward the center of the chest and securing it there with one hand while breastfeeding. For babies who like to flail their arms around when nursing, you can hold their arms gently against their body or try swaddling them. You can also use a breastfeeding pillow to prop up your baby and provide support while they nurse. This helps keep their arms out of the way and ensures that your baby is comfortable, too. We hope this video has been helpful in understanding the best positioning for your baby's arms when breastfeeding. Ultimately, it is important to remember that what works best may vary depending on both you and your baby. If you have any additional tips or tricks for successful breastfeeding, please leave a comment below. Don't forget to subscribe if you found this content useful. We release new videos every week with more advice on how to make parenting easier. Thank you so much for watching.